What antibiotics are used for pelvic inflammatory disease fertility? Pelvic inflammatory disease, often referred to as PID, is a serious infection affecting the female reproductive organs. It can involve the uterus, fallopian tubes, and ovaries. If not treated promptly, PID can lead to complications, including infertility, due to potential damage or scarring of the fallopian tubes. Understanding the antibiotics used to treat PID is crucial for preserving fertility. The treatment for PID typically involves a combination of antibiotics. These antibiotics are chosen to target the bacteria most commonly responsible for the infection. This includes sexually transmitted bacteria such as Chlamydia trachomatis and Neisseria gonorrhea, along with other types of bacteria. The initial treatment usually starts with broad-spectrum oral antibiotics. In more severe cases, intravenous antibiotics may be necessary. Commonly prescribed antibiotics for PID include ceftriaxone, doxycycline, and metronidazole. Ceftriaxone is an injectable antibiotic that effectively targets gonorrhea. Doxycycline is an oral antibiotic that covers chlamydia and other bacteria. Metronidazole is also taken orally and is effective against anaerobic bacteria. In many cases, the treatment regimen consists of a single injection of ceftriaxone, followed by a 14-day course of doxycycline and metronidazole. For patients who are hospitalized or experiencing severe symptoms, intravenous antibiotics like cefoxitin or cefotin may be used initially. Once the patient's condition improves, they may transition to oral antibiotics. While effective antibiotic treatment can cure the infection, it is important to note that it cannot reverse any existing damage to the reproductive organs. Scarring of the fallopian tubes can block the passage of eggs, which increases the risk of infertility and ectopic pregnancy. Therefore, early diagnosis and treatment are vital to preserving fertility. It is also essential that sexual partners are treated simultaneously to prevent reinfection. Patients should avoid sexual intercourse until treatment is completed and symptoms have resolved. From the perspective of fertility and endometriosis, managing PID promptly with the right antibiotics is crucial. PID-related inflammation and scarring can worsen fertility outcomes. Although endometriosis is a separate condition, both can contribute to pelvic pain and challenges with fertility. Therefore, accurate diagnosis and treatment of PID are important to prevent further reproductive tract damage. In summary, the antibiotics most commonly used for PID to protect fertility include ceftriaxone, doxycycline, and metronidazole. These are administered in combination to effectively cover the likely bacterial causes. Early and complete treatment is essential to reduce the risk of infertility caused by PID-related damage. If you suspect you have PID or are experiencing symptoms, always seek care from a healthcare professional for a proper diagnosis and tailored treatment plan.